I just wanted to, quickly before we wrap up, just to kind of say, like, anyone who's out there, like doing MSE, like, turn the device slowly. Do not turn it quickly like I did.
I'm good. Thanks for joining me on this recorded chat.
Of
And
course,
I believe today we're going to be talking about your MSE.
that is
I got
correct. Yeah.
I got your email. It had those scans, one from August 2020 and then one from April 2022. So they were about 20 months apart.
Yeah.
And
Yeah.
um, we can screen share those in a minute. And I know you want to talk about those. But yeah, basically what I saw in those scans was a huge MSE expansion.
Yeah.
And
Yeah.
I saw some other
Absolutely.
things, but why don't you tell me what you're hoping to get out of this call, and then we'll just dive right into it.
I guess. Yeah. I mean, I guess I mean, I wrote a whole thing, but I might just go off the top of my head right now. But yeah, I guess how I can continue to improve my health, kind of like that upwards health spiral that you talk about post MSE. Obviously I had quite a bit of um, asymmetrical expansion as you stated it. Yeah, how can I basically work around that? Maybe orthotropics, maybe myofunctional therapy, kind of stuff like that. How can I continue to
Hmm.
improve my health? And honestly, I just wanted to get on here and because I've never like talked about my MSE or journey really publicly, only kind of with my family, close friends. So yeah, I'm just excited to be on here too.
Sure, sure.
Yeah,
Yeah. So can we take a look at your smile?
sure.
Can you smile big for me
Yeah.
like this? Yeah. So I see that on your right side. Point to your right side for me. So on that side took most or all of the MSE expansion, didn't it?
It took a lot of it. I'm not entirely sure if it took all of it, but yeah, it definitely kind of went off on that side a lot. Yeah, for sure. I mean, I remember there was a point when I was just kind of turning, and I probably wasn't as vigilant as I should have been with looking at how each side looks compared to each other when I was turning. Um, but yeah, so. And that was two MSEs. I'm currently doing Invisalign. I'm on my like 12th cart right now. So
Mm-hmm.
hopefully correcting orthodontically, kind of, what do they call it? Fixing the like occlusal plane of the teeth.
Mm-hmm. Mm-hmm.
Yeah, so I mean there's definitely some asymmetry as I and with my doctor and I talked to him before this, so he said it'd be cool if I mentioned his name. He's been great
Mm-hmm.
though. Him and the team have been very helpful. And yeah, there's some asymmetry, but it's not really, it's not a perfect, device. You can't, I feel like you can't get a perfect split yet with the current technology of MSEs or whatever that are out there, unless you do the double jaw surgery, or MMA
Mm-hmm.
or something like that. So,
Mm-hmm.
but besides the asymmetry, I mean, I gotta say my nasal breathing's a lot better. And, if I don't have a lot of allergies going on right now, kind of like pollen, dust, it's pretty good.
Mm-hmm. Mm-hmm. Yeah, I saw that in your scans as well. I mean, your nasal passages just completely are huge now as compared to what they were before. Um, did you had you had some issues with your nasal breathing, and what inspired you to do the MSE, in terms of like aesthetics versus functionality, and how much like what changes have you experienced in your functionality specifically since that huge expansion that you did?
Hmm. Well, I guess what kind of got me going was in 2020 after I read. James Nesser's book Breath. I kind of got really inspired with jaw health, breath work, and all that. And I started meditating in 2019. Before that, so 2021, yeah, is when I got the MSE installed. Um, Hold on, I guess I should back up a little bit. So
Sure,
three
sure.
months, yeah, 3 months after the first CBCT scan, the one that's really everything's kind of tiny, and there was a even a deviated septum there. I'm sure you saw that.
Mm-hmm.
Yeah, I had everything corrected through septoplasty, bilateral turbinate reduction, that going through the ENT. So I guess what inspired me was the next step. I wanted to fix the jaw. I wanted to, I guess following your YouTube channel, I deducted that MSE was probably the best adult palate expander you could get on the market right now, and certainly one step below jaw surgery. So yeah, I guess that and wanting to be able to just breathe like everybody says, and I'm still working on it now. I want to work on my posture, and I guess that's something that's changed a little bit through MSE. I'm not sure if it kind of did some weird expansion on the right. Maybe it's at like my right side of my maxilla is at a weird angle now. It's hard to tell. So it's something I might explore in the future. Maybe
Yeah, can we
yeah,
talk about that for a second? Are you okay
sure.
talking about your asymmetry for a second?
Oh yeah,
It
yeah, yeah.
rem-
Go for it.
I mean it seems pretty significant, right?
Yeah,
And you know that. I mean, you're the
yeah.
one who's living with it. I
hmm
mean, what's your bite like on that side where that, on that right side where the teeth are so far out like that?
it's obviously not perfect yet. I mean, it's going to be better once hopefully once the Invisalign um, kind of changes the angle of the upper teeth, but it's getting there. I mean, yeah, my bite was like um, on the right. Yeah, it was very weird, like especially post directly after MSE expansion. My lower jaw would just go up like this. It wasn't going up and down like you're supposed to masticate. It was going like to the side. It was weird. And it's getting a little
To
bit
the
better now.
side, to which side? To the
It
side where
was
there.
so my mandible was like going like up like this to I don't know. It's weird, and I'm trying to do it as natural as possible without you know. But
Mhm.
yeah, it's I don't know. It's like so I don't know if this helps give any clarity or confuses more. So I did two MSCs. I maxed out a 6 millimeter one, and that was the biggest that they could fit in my mouth at the time because the palate was so small. So I'm just grateful they got his team got the 6 millimeter one in, and then after I maxed that out, he put a 10 millimeter one in, and that was weird.
Why?
Like especially going home too, and like knowing that he just like ripped one out and then put another in. I'd say there was a little bit more pain like for the next few days just because there was so much stress, like he undrilled one and then drilled another one back in, and so I waited 2 to 3 days to make that first turn on the
Mhm.
10 millimeter one. So I ended up maxing out the 10 millimeter one and only left it in for around 3 months of stabilization, not the full 6 months. And doctors actually wanted to take it out sooner at the 2 month mark, to try and rebalance everything. But at the time, I was just a little hesitant because I had done so much work and I didn't want to sacrifice that nasal airway. So I
Mhm.
kept it in
Mhm.
for another month. And, you know, I don't know. I think right now I might be stuck with what I got, but I'm starting to accept that and just kind of thinking of it as I gained a lot functionally,
Mhm.
breathing wise.
So he at one point. So first, let me just say, I think
Yeah,
that it's obvious that the right side of your maxilla, clearly in the bite, we can see that it's way out. It's way out there.
yeah,
Okay.
Yep.
and your smile is also severely canted
Canted. Yeah.
from the
Uh,
side that it expanded more. That
okay.
that being said, let me just finish my thought. Your mid face looks great. You look great overall.
Thank
Your
you.
breathing is great. So in terms of like, obviously asymmetry is not ideal and it's better to avoid it.
Right.
But here you are, and that bone is fused the way it is, right? There's
Yeah. I'd say.
there's no going back on that.
I'd say for the
So
most part. Yeah.
going forward in terms of, you know, again, looking forward, I think if you can bring those teeth in, get a normal bite back, and then eventually correct the canted smile. And
Right.
by the way, this is going to take a while. This is going to take like probably 1 to 2 years of orthodontics at least
Mm.
to bring those teeth on the right side in, and then to
Mm-hmm.
even out that smile to fix the cant. It's
Right.
going to take a lot of orthodontics. But once that's done, you're still going to have the expanded airway and those nice sharp features in your face. You're gonna look great.
That's awesome.
Yeah, but you do have this asymmetry that you're dealing with, and we can't beat around the bush with that. I mean, it is what it is.
No.
It's not ideal, and not I'm not going to sit here and tell you like it was a perfect expansion or anything like that. Like you've got quite a road ahead of you orthodontically to deal with this.
Right. Right.
So the teeth on that right side are going to have to come way in,
Mm-hmm.
and 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 that's going to involve not only tipping them, which you will need to do. You'll need to lingually tip them.
Mm.
You'll also need to some degree drag them through, move them through the bone. They're so
Mm.
far out there. You're going to need to move them in through the bone.
Hmm.
And these are molars, right? Like this is essentially the whole right side of your maxilla, the teeth up there.
Mm.
It's gonna take time, man. It's gonna
Right.
take time.
Right.
Um, so, so you're saying that the doctor, when you were at some point in your second MSE, he like wanted to pull it and sort of let it relapse a little bit.
Yeah, he wanted to pull it at around the 2 month mark. Um, and that's 2 months of after having finishly actively expanded. So I finished
Why did he decide at that point that he wanted to pull it? Was
at
he
two
because he
months.
wanted it? Yeah, he
Yeah,
wanted it
because
to
well,
relapse.
he wanted a little relapse because it was so far out there, and like by pulling it's a good way to try and get everything to come back in. But it's hard to tell how much expansion you'll lose. I think I probably lost maybe 2 millimeters, and I did 16 millimeters in total, which is you know a lot.
It's a huge amount.
Like a lot. And yeah, so I probably lost about two in the relapse, which is I'm not upset about that. I really shouldn't be upset about that because I had too much expansion probably.
Mm-hmm.
And yeah,
Mm-hmm.
he wanted to remove it at the 2 month mark, and I guess around the 2 month mark, the bone's not fully fused yet, and it's still malleable. It could still kind of play around with it a little bit.
Mm-hmm.
Um, and maybe craniosacral therapy could have helped. I never explored that option though.
To like what? To help it relapse even more? Is that what you're saying?
To maybe try and like I don't know, realign some of the bones in there to try. Yeah, I don't know. I don't know if it's 100% guaranteed.
Yeah, man. No, that's a huge ask. So,
Mm,
like, in terms of trying to determine what all happened with your maxilla, so I think it's a tough question, and I don't
yeah.
know if you've talked to your doctor about this, but what it looks like to me, and by the way, I've seen this before in other people,
Hmm.
it looks like the side that got expanded, which is the right side,
Right.
not only did it get pushed out, but it somehow got got dragged down too,
Hmm.
right? Or either that, or that the left side, which didn't get expanded, got
Mm,
pushed up. But the
hmm.
result was that not only did one side get wider, but that other side is now not on an even plane with the other side anymore. I mean, you can see,
Right.
and even when your mouth isn't open,
Mm-hmm.
the right side is lower, even with your
Yeah.
lips closed.
Yeah. Yeah,
So,
and I'm thinking like maybe um I don't know if the time frame actually matters, but maybe 2 to 3 years I might look into like that double jaw surgery to kind of like the I don't know cream on top almost. I know like that it's like you go MSE and then ideally your orthodontist, right, works with the surgeon because I mean I guess probably at this point the only way to fully correct all of what's going on in there bone wise is for them to literally like cut it open. I mean that's just the only way, right?
to just cut the bone and move it.
I mean that's the most surefire way to get like an accurate. Yeah, I mean
Sure.
I'm open to that. I mean but in probably 2 to 3 years probably.
Yeah.
Just because
So
I'm
I
gonna be going
mean,
back to school and everything.
yeah. How old are you, by the way?
30.
30.
Yeah.
Yeah. So I think the question of how to fix that asymmetry. Yeah, I think one option would be surgically, right?
Hmm.
The other option would be orthodontically. The orthodontic option is going to be much slower
Hmm.
to slowly move those teeth back into a decent bite and then to
Yeah.
slowly fix the cant. And I guess the question we have to be asking is that asymmetry at the level of the bone or is it a dental asymmetry? And that's what I don't really know. And like this is
Yeah.
why we need more doctors giving us insight into these MSE asymmetries. I suspect, and maybe what we can do now is we can go to those scans you sent me, and we can try to take a look at, we can try to figure out, is it just the teeth that are lower, or did that entire half of the maxilla get lower? Because if it did, then in theory, an orthodontic surgeon
Mm.
could correct that in a
Right.
couple of hours, right? Were you thinking of doing surgery for advancement as well, like just to continue to improve your airway, or
Yeah,
why would or would you only do the surgery to correct the MSC asymmetry?
no, if I was gonna do double jaw surgery, I mean, yeah, I would work on the mandible as well because when I was talking to Doc, we looked at that scan, the most recent one. And by the way, he said that it wasn't a very good scan because scans are it's like a moment in time. It's kind of like, and when I took the scan, I was actually swallowing, so you could see my hyoid bone is actually up, and then my tongue is up, but my tongue is too far back. So I guess from a myofunctional standpoint, it needs to be more forward, the tongue.
Mm-hmm.
So you can see from the scans that the root of the tongue is actually kind of closing off the airway. Um, but what I was trying
Let
to
me go.
say,
Let me
yeah, yeah,
let
pull
me
it up.
go to the scan right now.
Yeah, go for it. So that's the
I
old
think
one. Yeah.
so. This is the before scan from August 10th, 2020. You can see is this the deviated septum you were
Yeah,
referencing?
I had that corrected. ENT
Okay,
before MSE. Yep.
before the MSE. Okay.
Yeah, before. Yep.
Um, is there a reason you did that before rather than after the MSE?
Um, Not really. I mean, I just basically my insurance covered it and it was easy enough. There was a really good surgeon in the area.
Mm-hmm.
And to be honest, I don't think I really looked into much reason as to maybe getting it done after MSc. I'm not, yeah,
Mm-hmm.
I didn't do too much research. I just kind of wanted to take that step and then after that was the MSc.
Yeah. No, I mean normally I recommend to people to do nasal surgery after the MSE, but
Oh,
I mean
really?
in your
Okay.
case, and yeah, because sometimes the MSE negates the need for it. It just blows it open so wide that
Right, right.
you don't even need the soft tissue surgery. But in your case, like you got the results, and that's what matters.
Yeah, definitely.
S- So let's take a look at the teeth here, though. So you're in. This is the before scan
Yep.
from August 10th, 2020, and here's your intermolar width at 27.4 millimeters, right?
Yeah. Yep.
And now let's go down to the after scan, and you can see. So now your intermolar width is 41.42.
And by the
This
way,
is
Ron, there's another scan I didn't send to you because it's not the most recent, but that was after I finished MSE expansion, and I actually I got it up to like 43 and change. So it came down, yeah, like I said, like a millimeter or two. So, but I just
mm-hmm,
included the most
mm-hmm,
recent one. Just wanted to include that little tidbit.
mm-hmm. No, thanks for letting us know. So
Yeah.
this is April 5th, 2022, which is 20 months after this scan was taken on August 10th, 2020. And here you can see, I mean,
Is that just looking
let's
massive compared to it?
let yeah, well, let's just go back. So here's the before, 27.4 intermolar width, but also look at the position of these teeth here. So the upper right teeth are not even edge to edge with the lower teeth. And now
Yeah,
look what happens. Boom. That's like,
way out
I
there.
mean, you're right. The left side did get some expansion because here now the upper teeth are outside of the lower teeth, whereas
Right.
here they were, oh, sorry, here they were sort of edge to edge.
Mm-hmm.
And now here they're on the outside. But
Mm-hmm.
look at this side. I mean, this side just
Yeah, the right
went
side took
for
off.
it went for a ride.
Yeah, yeah.
And I mean, you didn't even have a bite there when all was said and done. That's just totally Brody bite, which
No,
means
it
that
was completely out there.
they're not even touching.
And
I mean,
yeah.
if I'm being real, like that's too much, man. Like
Yeah, it's too
I
much.
don't I don't I don't think that should have ever been allowed to happen to you. And
Mm.
and and by the way, if I get a little critical here, I'll just pull the name of the doctor, and I plan on doing that anyway. Um, so you don't have to worry about that. But this is not right, man. Like this is extreme. And I understand that. I mean, look at your nasal passages. Boom, huge, right?
I mean,
Huge
it's
as
that,
compared to
yeah,
look at
definitely.
how tight it is,
Yeah,
right?
yeah.
So your nasal volume is just completely corrected.
Mm.
But you've created this orthodontic nightmare here where
Yeah,
where you don't even have a bite on this one side, and these teeth are going to have to be dragged back in.
yeah. I
Um,
mean, it's
which
definitely gonna
again
be a
is
lot of work. Yeah.
it's going to be a slow, brutal process. But also, let's look at the plane, right? So you can see that here they were somewhat flat and even. I don't think you had too much of a canted smile to begin with, but now it's like you can see. I mean, even his own line drawing the intermolar width
Yeah.
is at a huge. It's at a huge canted angle. So the MSE created a cant in addition to a Brody bite for you. This is a classic case of the MSE asymmetry that I talk about on my channel. Um,
Mm-hmm.
you know, and I feel for you, bro. And it's very common. And it's a mixed bag, right? Like, and even you're the one who didn't want to let it relapse because the gains that you got were so significant in terms of your airway. I mean, you were
Yeah,
probably
and
just feeling great.
yeah, no, that's true. And yeah, exactly. It was, when I was nearing the end of, my turns on the second one, my doctor was like, okay, you should probably stop turning now. So I mean, I got to take full responsibility on that. It was me who I wanted to push past it. So and I'm the one who kept it in at 3 months. So I take full responsibility on that. But I hear you. We just it's good to get information out there. It's good to get cases like this out there too. Yeah.
100%, man. And I really appreciate you coming on and
Yeah,
sharing your case,
of course.
because people do need to see uh, these asymmetries and what they look like
Mm,
in real time, and they also need to understand that it is a double-edged sword, right? Like the MSE
true.
is blowing open your airway, helping you breathe better, but at the same time, it's chaotic, and it
It
can
it's not
do
perfect.
this.
It's not perfect
No.
yet. We don't have that device yet. I don't know
Well,
if it. Yeah,
I've always said the MSE is it's an axe, not a chainsaw,
that's
right? Like
true. Yeah, that's good.
if
That's a good way
you
of putting
take
it.
a if you take a log and you put like a if you axe through it to make firewood or something, you never know, like, is it gonna be a perfect even split? Are we gonna
Right,
get, like, a nice perfect cut in half, two pieces of firewood, or is, one side gonna break off as just like a small sliver and then the rest is gonna go to the other side? Whereas with a chainsaw, you can just precisely cut right down the middle and
right,
get two perfectly even halves. The
right.
MSE is a splitter. It's an axe, not a chainsaw.
I mean, yeah, and then you also got to take into account that like everyone's like anatomical structure is not like perfect and it's different and yeah, I mean the MSE they try to custom make it to you as best as possible, but it's hard because the human anatomy is it's very complex. I mean, I'm sure you know, like we're all everything's connected, like sutures, bones, especially in the
Mm-hmm.
face too. Yeah,
Mm-hmm.
like so when you try to take an axe to that, it's not going to be perfect. I mean,
No,
most
for
of the time.
sure.
Maybe it is sometimes, but I don't know.
For sure. And what's causing these asymmetries, and why this seems to happen, and why there's more resistance on one side of the face than the other,
Mm,
is a complex question.
yeah,
And I think you're right. I think it's all interconnected, and we're never really going to be able to pinpoint ahead of time in a patient if his particular facial structure is going to lend itself to one of these asymmetries.
hmm,
I think the more interesting question is, how can we prevent this from happening? What
that's true.
what surgical assists can we incorporate to prevent this from happening, or, like, how can we install the MSE and monitor it
Mm,
in such a way that we prevent this from happening? And I think that's something that I really want to drill down upon with
hmm.
providers, because that's not something you and I are going to be able to answer, right? That's a question for the doctors who are actually doing it.
Right,
Um,
right.
Before I forget, one other thing I want to
So,
look at with you,
yeah.
I want to look at your left zygoma, or your left zygoma versus your right zygoma, and I want to see if we can see the asymmetry manifesting in your cheekbone as well, because I think I just saw it.
Right
So,
here?
in
Yeah.
in theory, that side, point to your left side for me. That side should be flatter, and then the other side, if it really was expanded more at the level of the bone, should be more pointed if we
Hmm.
look from the diagonal,
Okay.
right? So if you look at me, for example, let's look at me. Here's the side that expanded less. You can see when I go like this, it's a little bit, or like this rather, you can see it's a little bit, compared to this side, going to be a little bit flatter. So watch what happens when I go like this. Well, I guess you can't super see it, but this side got expanded more,
Your left
and
side. Okay.
my left side expanded more, and it's sharper when you look at it from the side
Okay.
as compared to this side. See how it's a little flatter
A
here?
little flatter. Yeah, I think that's the same case on my left side is a little flatter. My right side
Yeah.
is a little blown open a little bit. Yeah.
Can we see that?
Yeah,
Can
go
you
for
like
it.
rotate
Let
for
me
me a little
just
bit? Stop right there. Uh, Go back the other way. Okay, come back a little bit toward me and then pause right there. Stop. Okay, stop right there. Yeah, man, the zygoma on your right side is, you definitely got some bone-borne expansion with that MSE. I
yeah.
mean, that whole right side of your face is expanded. And now go the other way for me so we can see. Yeah, man. Other Come back a little bit. Uh, a little more. Other way. Yeah, stop right there.
Yeah.
Right there. Yeah, so definitely it's this happened at the level of the bone. And this is, again, very common. I've seen this probably a dozen with a dozen different people.
Okay.
Um, and it's common. I mean, it's happening out there with the MSE.
Yeah, and
So
yeah.
go ahead. I'll let you finish your thought.
Yeah, I was gonna say, um, probably more so. I don't know if that's true in the case of the like inexperienced MSE provider. I mean, in my case, I had an experienced MSE provider, but I kind of just did my own thing per se. Um, I did. I definitely did. But in my case, I had an experienced provider, absolutely. So I don't know how it would look with an inexperienced MSE provider. Probably you got to really keep an eye on that.
Yeah. So, I mean, my opinion is that no doctor should allow to happen what happened with you, which is extreme. So I hear what you're saying, that you were headstrong, you wanted to maximize your expansion, you wanted to get while the getting was good, you felt your airway getting bigger with every turn, and you were wanted to keep that, even
Right,
at a sacrifice of some symmetry and future orthodontic work that would have to be done to get the bite back.
right,
But like I mean, you can't put it on you, man. Like, sure, you can take a piece of the responsibility, but at the end of the day, like, someone should have been telling you, hey, man, this is what's going to happen if we don't allow this to relapse a little bit.
right.
Just putting that out there. But
No, that's true. Yeah,
stepping back from your case, stepping back from your case, you are absolutely right. Um, This is why it's so important to have an experienced MSE provider, because an inexperienced MSE provider might not have an eye to see this type of asymmetry developing in
hmm,
real time, whereas an experienced MSE provider will have had cases like yours and will have gone through the years of orthodontics that it's going to take to correct that asymmetry, in terms of slowly working those teeth in on the right side and then
right.
slowly intruding them to correct the cant. It's doable, and when that process is done, you're going to look great and you're going to feel great.
Yeah, I
It's
was
just
just
a
gonna.
lot of friggin' it's just a lot of
I
friggin' work.
I know, I know. I mean, I guess if something is completely avoidable and you know how to do it, I mean, I guess that's like the best option, right? I mean, but if something happens like me, like, yeah, I mean, there was a time where I was like, excuse my language, I was like, oh shit. Like I did a lot of expansion and like my right side is like completely blown out. Like I'm breathing great, I'm sleeping better, mewing better, but um, at some point I just had to accept it, and I got to move forward. It's for my mental health too. I mean, so it's meditation's been helping me a lot. I want to get into, I want to get more into like posture training,
Mm-hmm.
yoga, stuff like
Mm-hmm.
that. I think that'll probably help maybe overall, just to like improve my body posture overall. Maybe it'll help in the long run. So, and then again, exploring that orthognathic surgery kind of route in a few years, and maybe get his opinion or her.
Mm-hmm. Mm-hmm. Cool, man. So, I want to give you an opportunity to transition the conversation towards something you've mentioned a few times now, which is like next steps for you in terms of incorporating a more full body type of
Mm.
approach to your health. Um, did you want to sort of transition to that topic and step away from the asymmetry thing
Yeah, sure.
for now? And yeah,
Yeah.
why don't you lead the way with that? I don't know if you have some specific questions prepared.
Um, yeah, I don't, not too specific. I mean, I guess just try and be more mindful of like, like my head posture. Kind of like when I'm looking at my phone, I try not to like look down like that for too long. Yeah, I mean, I guess basically I'm open to ideas and tips on how to just maximize that full body um, posture retrainer, basically.
Mm-hmm.
So,
Mm-hmm.
Especially I feel like my shoulders too. I don't have any pain in the shoulders, so I think it's just more so I need to get my blade scapulas like down and back more so. So I don't. Yeah, I could retrain that. Whether it's do
Hmm.
like scap push-ups, pull-ups, kind of stuff like that. I'm totally open to that kind of like training, like you mentioned, weight training, but for posture and not crazy weights, just body weight,
Hmm.
focusing on
Hmm.
form. So yeah.
Hmm. Yeah. So, absolutely a hugely important question, and uh, I've been talking about this quite a bit recently. But so I usually start with Esther Goklay's book, Eight Steps to a Pain-Free Back.
Okay.
Have you gotten a copy of that yet?
No, I haven't. I'm gonna um, have to write that down.
Yeah. So I'll, you know, well, I was going to screen share it, but it's not really necessary. So
Okay.
that's the starting point for anyone who wants to start working on their full body posture.
Yeah,
Okay,
I'm.
so
Yeah.
Esther Goklay's book is essentially a picture book of people in more traditional parts of the world who have
Okay.
preserved primal posture.
Mm.
Um, and you can essentially just look at these pictures, read the brief descriptions, but then mostly just focus on looking at the pictures and then use your mirror neurons, which is basically your body's own uh, natural ability to look at someone and look at someone's
Mm.
activity and then copy it.
Oh,
Like we're
okay.
really good at copying other people's physical activities and motions
Okay.
just by watching them. So you can
Interesting.
essentially look at these pictures and then start to download and then mimic the pictures that you're seeing in that book. And that's a good starting point.
That would be
Like
awesome. Yeah.
that book tells you the destination. That's the ultimate goal is to establish the postures that you're seeing in that book.
Okay.
Now, getting to that point and working your way up to those postures is where we get into the weeds a little bit and where we get granular in terms of how do we get these tricky parts of the body, because there's a few parts of the body that are especially tricky, and the scapula, the shoulders are definitely one of them.
Yeah.
How do we get them to sort of budge? And I think you're onto it with regards to scapular pull ups, scapular focused push ups, and then in general, keeping your shoulders down and back in everything that you do. And
Yeah.
as I mentioned in my last video, you want to take the shoulder blades and you want to imagine tucking them into your back pocket, right?
Yeah.
And then actually
Oh,
trying to
yeah.
engage the muscles back
So
there.
like, yeah.
And
Tuck it in.
so
Okay. Yeah.
so here's what a normal person's shoulder posture might look like,
Mhm.
right? You can see they're kind of just like lazy. My shoulders are coming out in front of my collarbone. What I'm saying is that's it right there. It's kind of subtle, but and it might be easier for me to show you with like my shirt off or something. But so you want to go from this, and by the way, some people are even worse. Some people are like this,
Very,
right?
very kyphotic. Yeah.
Very kyphotic, but
Yeah.
you want to. So the best way to achieve that is to imagine your shoulders going into your back pocket.
Kind of like,
And then the
like,
other thing
yeah.
yeah, go ahead.
Reaching for the phone in the back pocket. Is that a good cue?
Exactly.
A good cue? Yeah.
100%. That's a good
Yeah.
mental mantra that you can remember.
Yeah.
And then
It's.
you don't want to just practice doing that like at rest when you're sitting around. When you're doing weight training,
Mm.
you actually want to focus on having your shoulders down and back like that,
Mm.
even while you're lifting, while you're doing pull ups, or while you're
Mhm.
doing push ups, right? Or while you're doing anything, even if you're doing a kettlebell swing, right? You
Right.
want to you want to imagine taking your scapula and going down and back with it while
Oh,
you're
okay.
swinging.
Okay.
So no matter what you're doing, you're preserving that down and back position of the shoulder blade.
Mhm. Okay. Um, yeah, I mean that definitely would help with you know technique in the exercise and being able to I would imagine work out for longer too. I mean, if you have greater efficiency in the technique with like greater posture, you're just going to be more efficient. And then if you're
Hmm.
like you said, if you do something kind of like that posture or mewing with a tough, hard activity in the day, just like doing it normally throughout the day should be a little bit easier if you can maintain it during like a high intensity workout, something like that. I,
Well said, man.
yeah. I should mention that my left side feels more tight than my right. I mean, I am a righty, so I'm not sure why my left side feels more tight in the scapular area, and then why the left side didn't expand as much as the right. I don't know if that's all correlated, or if it's because I'm a righty. I mean, these are questions that I don't have the answers to yet. Be great, but
Yeah, so
tough
I don't
ones.
know if there's a connection between the shoulder on the left and right side and the expansion on the left and right side. Um, I don't know. But in terms of why one side is tighter than the other, in terms of your arms and shoulders, I'm the same way. It could be because your right arm gets used more, and so it's just stronger and looser,
Hmm.
whereas your left side sort of literally just kind of chills like this all day. You know, um,
Yeah, it's true. I try to make a point of like using my left arm more, just throughout like throughout the day or randomly if I'm like bringing in groceries or if I'll try brushing my teeth lefty, and that's a rare case for me, but I'll try it. It's very awkward. But
yeah, no, that's hard.
just in general, I try and just engage that left side as much as I can because I know that my right side is going to be used more. So I don't know.
Hmm.
Be curious to see if someone who had like perfect symmetry, like super relaxed, I don't know, perfect bone structure, whatever, got an MSE if it split perfectly. If that would happen. I'm not sure if it's, again, it depends on the bone structure of the person. I don't know.
Someone in that position wouldn't need an MSE.
Probably true because yeah, they had proper development growing up.
Exactly.
Their tongue did the work for them. My tongue was not doing anything. And I should mention, I had a lot of sinus issues as a kid as well. That probably, I mean, I'd imagine that all contributed to my like super narrow, um, superior palate, just basically until I was like 29 years old. Like mouth
Yeah,
breathing
and
for
you.
29 years. It's so bad for you.
Yeah, yeah. Can we see your side profile?
Yeah.
Can you
Just,
step back and so that we can get a good look at what you look like from the side?
yeah.
Perfect. Mm-hmm. Mm-hmm. Yeah. So first, I just want to say I think you're a real handsome guy.
Thank you, Ron. Appreciate that.
Yeah. I think you're a good-looking guy, and I think you look like you're in great shape. You know.
Very, very skinny. I'm like 145 pounds sopping wet. I probably would like to be a little heavier though.
How
But
tall are you?
5'9".
Nah, man, you're all right. I mean,
Yeah.
if you've got some muscles under there, you know, some good core muscle that's contributing to that weight. I mean, I'm 5'9", 147.
Okay.
I hover between 147 and 152. You
Okay.
know, and I'm not dying to put on more weight, but yeah, probably another 10 pounds of muscle would serve you well.
Yeah, that's kind of like what I was thinking. I don't want to do anything crazy like 30 pounds. I don't need to be that heavy.
Yeah.
Yeah, no.
I mean, I, I'm I mean, I've got a long way to go in terms of what I'm trying to accomplish, but like, I mean,
Yeah,
for me, I'm not necessarily trying to put on any more mass, right? Like,
right.
I've got I'm stronger than I look, like functionally.
Yeah.
It's not very bulky, but it's very like it's very wiry. And so,
I think I'm the same way, very wiry.
mhm. Mhm. So, yeah, good man. So, in terms of um so posture, you're gonna get a copy of Esther Goklay's book, 8 Steps to a Pain-Free Back.
Yes, definitely.
Besides,
Yep.
did you have any follow-up things you wanted to talk about posture? And if not, what other topic do you want to cover?
Um, I mean, we kind of brushed on it a little bit. Like, I guess the topic of forward advancement is something I'm interested in as well.
Yeah.
Maybe not at this point orthodontically because I'm not really interested in AGA. I don't want to destroy my teeth. Um,
Smart. That's
yeah,
smart.
I actually so that first scan was actually taken uh, and so all I did was get the scan there though because he tried to get me basically started on like an AGA plan. I just ended up not going with it. It was so expensive at the time. I mean, it realistically was probably the same price as MSE.
How
Um,
much?
I think MSE was cheaper though. I think AGA was probably like 14 to 16 for everything, and my MSE was 12,000 for everything, so that wasn't too bad. I mean, it was expensive,
Yeah.
but I had to pay a lot of out of pocket. Unfortunately, insurance did not cover that, which is kind of strange. It was definitely not purely aesthetic for me. It was very medical, getting that tongue out of the throat when I sleep. So maybe in the future we could work on insurance companies covering stuff like this. But
It would be good, man.
in an
I'll let
ideal
you fight
world,
that battle, though.
in an ideal
Sure.
world. Oh yeah.
Yeah. Yeah, no,
Um,
insurance, I mean, I've heard of insurance partially covering, MSE treatments, but only as, like, because they'll cover orthodontics a
right,
little bit, right? Not
right,
because
right.
MSE is an airway treatment, but because it's an orthodontic treatment.
Huh. Okay.
Yeah, but that's pretty rare, and your insurance has to have that
Hmm.
built in as part of
Oh,
like what's
okay.
covered.
Oh, wow. Okay.
Yeah, no, but stepping back, like, yeah, of course, no, AGA is not, that's not an option for you. Um,
No, no. I'm thinking at this point I just need to work on like proper tongue posture, proper full body posture, and then yeah, I guess maybe explore that double jaw surgery in the future if it's necessary. I gotta see how I'm feeling though.
yeah, why
Um,
would you do it? Like, would you do it because you're still not breathing right, or would you do it to look differently, or
well,
what's your thought process?
well, I was gonna mention that in the most recent scan, it did look like my mandible. I mean, it for sure could use maybe 4 6 millimeters. I don't know, something like that. I yeah, I mentioned it because I feel like forward advancement it's only going to help me. It'll give my room, it'll give my tongue, excuse me, more forward backward room. Right now it has a lot of transverse room, which is great. I mean, it helps, but I feel like forward advancement could only further help it. And
Yeah,
I guess I sometimes do feel constricted when I sleep on my back, and I don't know if that's because I'm fighting gravity there, but yeah,
yeah.
just some
No,
thoughts.
sleeping on your back is never going to be a good option.
Hmm.
I'm sorry, sleeping on your back with your face up is never going to be a good
Yeah,
option.
like that.
S-
Okay.
Right. I
Okay.
sleep on my back, but with my head to the side.
Head to the side. Okay.
Yeah. So I love being on my back. If I try to sleep on my side, I'll almost inevitably roll back onto my back.
Yeah,
But
same.
you can you can get the best of both worlds by being on your back but with your head to the side.
Okay.
So I talked about that in a recent video. I'm going to do a video on that soon demonstrating what I mean.
Yeah.
Um, but yeah, man. So what my thoughts on you getting some sort of advancement
Hmm.
is that if it does happen, that's a long ways away.
Yeah.
Because so for starters, there's going to be no appliance that gives you that advancement.
Yeah. Yeah.
Okay? So you can rule out any type of, removable expander that's going to expand you forward. That's just going to wreak havoc on your teeth and take your 2 to 3 year orthodontic journey that's ahead of you to
Mm-hmm.
fix your asymmetry and to get your bite back,
Right.
and it's going to double it.
Mm.
It's going to
Yeah,
turn
no,
it into a
definitely
5 to 6 year treatment. So
don't
just
don't want
forget
that.
about that.
Mm-mm.
No. Now, in terms of orthodontic surgery to advance you, first I would say, because it's going to ultimately be such a long road for you, it's already
Mm-hmm.
been a couple years and you've got at least a couple more to
Mm-hmm.
orthodontically correct this asymmetry.
Right, right.
You're 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 only going to want to do that if it's really essential to your health
Like
at that
absolutely
point.
essential. Okay.
I mean, dude, you're a handsome guy, okay? You got
Right.
really nice eyes if you don't mind me saying,
Thank you.
okay? You got a nice. I like your facial hair. I like your style. I like your haircut. The
Thanks.
the big blue eyes. You got a very wide interpupillar distance.
Okay.
Like the MSE did
Oh,
your
it
zygomas
changed
a
that?
lot of good.
Oh,
I
wow.
don't know if it changed your interpupillary distance, but your zygomas look great.
Right.
Okay, you're a handsome kid, man. Like
Yeah,
I
that's the
would.
thing. I don't want to overstep too much and like, get something done and be like, "Oh man, I wish I hadn't have done that." So I'm gonna just play this card out like you said. Work on that orthodontic asymmetry fixing, if you will, and then go from there.
100,000%.
Yeah.
Yeah, your next 2 years of orthodontic work and treatment is going to be focused on getting your bite back together.
And does that help a lot? You find with being able to get your full tongue up there, like, when your teeth are fully biting slightly. I mean,
Yeah,
does
man.
it
I
make it
mean,
more comfortable? I guess
dude,
yeah,
the bite is everything, man. The bite is everything. I mean,
yeah.
right now, you're living with severe malocclusion.
Hmm.
Your airway is much improved, but at the expense of a different component of your health,
Right.
which is your occlusion, which is
Mm-hmm.
the way your upper and lower teeth come together, which is your bite.
Right.
Think about it, man. Most orthodontists, all they care about is your occlusion. Like
Right. Right.
orthodontics is literally the branch of dentistry that delivers occlusion to people. Occlusion is a key to health.
Yeah.
Like
Okay.
if your bite's not good, a billion things are going to be misfiring neurologically and
Hmm.
like
Inter
functionally and like
Really. Hmm.
so you're not going to experience full health and well-being and the full benefit of your treatment until you get that right side back in line.
Just gonna have to
So
get her in line.
the gold at the end of the tunnel, the pot of gold at the end of the tunnel for you right now, first, second, third, fourth, fifth, sixth, seventh priority for you, up to 100, is just getting your occlusion back together.
That sounds reasonable. Sounds good.
Yeah. So, um, and and what's the plan for that, if I could ask? Like,
Plan
what's going on right now with your treatment? What are you doing?
right now. I'm doing Invisalign right now. I'm on number 12 of 26 of the first two boxes that they sent me. So they did a scan and came up with 26 Invisalign carts. I'm on 12 right now. That's where that's the plan right now, and then we're just he wants to check in. He wants to check in like halfway through, so probably at the end of the next cart, I'll probably go in and he's gonna, you know, I guess just like take a look at how the occlusion is looking,
So,
or
how many
my,
weeks until you see him next?
um,
So you're saying
yeah,
that could be months,
it
months
could
until you see him
be.
again?
I mean, it could be. Yeah, I don't have a date right now. He just said just keep on the Invisalign track right now.
Do you have a digital representation of your Invisalign Clin check that you can show me so that we can see where you're headed with those trays?
Yeah, I have the app. I'm not sure if that are you able to do that on the phone?
I don't know. I don't know if you're going to be able to screen share that with me.
Mm.
You know what, man? If you could somehow send me that so that I can just take a look at it,
I can
because
send you,
I
yeah, I
want
can
to
send you screenshots, yeah, for sure.
send me a screenshot of what the final bite is going to look like,
Final bite? Okay, yeah.
because I want to make sure you're headed in a good direction here, because you're kind of on a blind faith journey, hoping that this Invisalign is going to get you to where you need to go. And by the way, I know for a fact that the Invisalign is not going to be enough to fix you.
Okay, okay.
And I can tell you why.
Are
Because
you
the
thinking like,
Invisalign is not
yeah.
going to, it's not going to fix your cant.
Hmm. That's where
It's
like that
just not.
the power chain comes in.
That's
Something where you
where,
hook it up to the teeth and then it kind of like sucks one in or something like that.
yes, that's where
Um,
it's a buckle tad system, which means
yep.
you're going to need, so here's the right side, right?
Mm-hmm.
So you're going to need tads, probably a couple of them, on
Mm-hmm.
this side of on the buckle side of your right half of your maxilla, okay? Buckle right. And then
Okay.
you're going to need to take those teeth and you're going to need to intrude them
Okay.
so that so that it goes from being like this
Mm-hmm.
to being like this.
I'd imagine that helps with posture too. Just feeling a little bit more upright.
Bro, it's a huge deal, man. Like
No,
I'm
I
trying
have
not
mentioned that to him before, so it's definitely in his mind. But I think he just wants to see how this turns out first. I will send you the screenshots, but if I could just describe it a little bit right now, I mean, the
sure.
the lower right, like the bottom, really comes out. I mean, he's trying to match it with the top, and then the top right is like kind of going to be angled in a little bit too, to try and match that bottom right side too.
Okay,
Um,
so that's going in the right direction.
yeah, yeah,
I
no,
mean,
it.
ultimately, your bottom right is going to have to come out a little bit, and your upper
Oh
right is
yeah,
going to have to come in a little bit.
right, right.
But
No,
that's not going to be enough, man.
no, I
You
know.
might get a bite back that way, but in order to fix your cant,
Yeah, power chain,
there's well tads,
TADS. Okay,
Ta-
useful.
tads and power chain, or tads in some sort of elastic tension
Mm,
that's going to intrude the teeth on the side that's lower,
okay,
which is your right side.
right. And do you
So,
have to do
I
that
mean,
immediately, or when is it recommended usually to start the TAD system?
bro, that's what I'm saying is like
Yeah, I should hit him up.
you're look, you paid me to talk, right?
Yeah,
So I would not be fulfilling my end of the bargain if I didn't tell you what I thought was right.
yeah.
I'm concerned that the post MSE orthodontic plan for you is not where it needs to be.
Okay.
Okay, I'm not a doctor, okay?
Yeah.
I yield to the expertise of the doctor. But if there's no concrete plan in place to fix that cant of yours,
Mm-hmm.
which is severe. I mean, look, severe is a severe word. It's
Mm-hmm.
significant.
Mm-hmm.
This is a very common thing that I see in patients, and I myself have experienced this. You kind of like you convince yourself that what you want to happen is going to somehow happen, even though there's no evidence in the real world that it's going to happen. So like I can hear you in your mind. You're like, no, he's got that covered. Like he's going to take care of that eventually. Like after the Invisalign trays is like he's going to solve this other problem.
Mm.
But what I'm saying to you is there's no reason to believe that that's the case. If there's no active discussion of the tactics and the strategy that he's going to use to correct this cant,
Mm.
then it's more likely that there's just no plan to correct it.
Okay.
And my experience is that cants are, for whatever reason, orthodontists have huge blind spot when it comes to maxillary cants. It's just like it's the elephant in the room that no one ever either they don't see it or they don't know what to do about it, and so they just ignore it. So it's very possible that your cant is being neglected.
Mm,
And
okay.
I don't want to see you waste a year where it's going to, where a year of your valuable time that could be otherwise spent getting you from A to B. And now you're just plugging and chugging with this Invisalign, hoping that the clean check was done correctly and that you're headed to a good place.
Okay.
So, I mean, we're recording and I'm going to be posting this, and so I'm reluctant to be too critical. And by the way, I'll definitely be removing the doctor's name. So you
Okay.
don't have to worry about that.
All right.
Okay?
He said it didn't matter, but yeah, sure. It's all good.
No, out of
Either
respect.
either
Because
way, yeah.
so,
Right.
so, and out of respect for that.
Yeah,
But,
yeah.
um, but I think you need a second opinion, man, because this whole like Invisalign plug and chug, see you at the end of your box like 3 months from now,
Hmm.
bro. You need to be seen once a month in your situation. You need
Yeah.
someone who's got an active plan to correct that cant, to get you a bite that's being pursued with urgency
Hmm.
so that you can normalize.
You're probably right.
Okay, and
Yeah.
forgive me if I'm overreacting, man, but
No, I appreciate the enthusiasm. Seriously. I mean, you
so
you you
I mean,
genuinely care. I appreciate that. Thank you.
I I genuinely care, and I'm also very familiar with your specific situation.
Okay.
Okay, MSE, asymmetry, leading to a maxillary cant, and
Right.
then years of orthodontics to correct it. It's very common. I've seen it before, and I'm trying to help you
Yeah.
cut that process in half because
Right.
you've gone, this could very easily go from being a 2 to 3 year process to being a 4 year process or worse if you don't go for the throat on this.
Yeah, I mean, it's been 6 months already in Invisalign. I started, uh, or almost, like I started February of this year.
Yeah,
Uh, yeah, so I mean, yeah, definitely want to know more about what he's going to do with the cant. I mean, it seems like it's a major like um, piece of the puzzle that needs to be corrected.
it's a major piece of the puzzle, without a doubt. I
Hmm.
mean, bro, you're even when your mouth is closed, and I know I've mentioned it, but I just
Yeah, go for
because you see yourself in the mirror every day,
it.
maybe you don't see it, but I see it.
Hmm.
I mean, even your closed lips are like this, brother.
Yeah.
Like, you gotta, you gotta fix this.
And does that help? Like with when you correct the cant, it kind of shifts everything.
It helps with function, absolutely.
Okay. Okay.
Of course it does, because right now, so I can't, exactly explain the kind of domino effect that the asymmetry could be causing throughout your body, but
Hmm.
it's not helping, man. It's not helping with your full body posture or with your neck posture. You're probably compensating.
I feel it in my neck. Yeah, I feel like I lean more to my right side for some reason. Um, but yeah, I don't know. Yeah,
So for
yeah,
sure, man.
for
Yeah, I
sure.
mean, um, it's something that you got to keep in mind, and we can talk more offline about um, a second opinion that you might consider getting.
Okay.
Um, in fact, let's do that.
Okay. Sure.
I want to after we disconnect, I want to talk a little bit offline about game plan ahead for you.
Okay.
It's
Yeah.
it, it's basically gonna involve having a conversation with your orthodontist, seeing where he stands,
Yeah.
and
Yeah.
if that doesn't, if you're not convinced at that point, then bro, you need a second opinion, man. Like you need,
Yeah. No, it's serious. Definitely.
yeah,
Yeah.
okay. Anyway, what else do you want to touch upon before we wrap up? We're already over an hour. We should probably wrap soon. But I want to make sure that you don't have any loose ends.
No, I just wanted to, quickly before we wrap up, just to kind of say, like, anyone who's out there, like doing MSE, like, turn the device slowly. Do not turn it quickly like I did. Um, I did want to mention that I did experience a lot of numbness on the right side. And I'm not really sure 100% why. Maybe I went too quickly, and the bone was moving too quickly, so like the nerves just could not keep up with that much of expansion at a time. So just if you're turning that device, please turn it slowly. Don't overturn basically, you know.
How quickly did you turn it?
I started at like one turn a day, and then I kind of ramped it up to two a day. I mean, some days I was turning like three, four at a time. It just kind of depended on my mood. Um, yeah, but it was like one, two turn a day until the split, and then I kept going, and eventually I had to take like a week off because it like the numbness was so bad, and I needed some time off because it was like burning. I don't know if you ever experienced nerve pain or anything like
I
that.
have. I have.
It's not fun. So
No, I've never heard of anyone getting nerve pain in the face with MSE expansion. This is a first, but
yeah, so it was a
so what
wild
would you do?
ride.
So what I often tell people in order to avoid asymmetries and Brody bites that
Right.
result from asymmetries where
Hmm.
one side goes way out to left field, I say, look, you might not see it in the mirror, but you will feel it in your bite.
Mm.
Like when that one side is getting blown out, you're going to start to realize that it's not making contact
Hmm.
and the bite's going to start feeling off.
Yeah.
What would you say to people about, um, avoiding ending up in an asymmetry? Like if you could go back and do it all over again, how would you do it different?
Basically. Yeah, I probably would turn like I would do one turn maybe once a day until it split, but then when it split, maybe just one turn every other day. And that's eventually what I ended up doing at the end of the treatment. Um, and I was working with my doctor then, and he was like, "Yeah, just bump it down to like one turn every other." I might even start doing that earlier on in the treatment just to so you can probably keep a better eye on it. It's probably, easier on your body because it's a lot. I mean, you're literally ripping apart your face. So, I mean, I took that for granted, and I was like, oh yeah, let's just crank it out, man. Just get the turns in, and no, dude, you got to be careful. I was doing
Yeah.
face masks. I did face masks for 3 months. Just, it's a whole different topic, but just I did this one, the one that's on the chin and the forehead. So I didn't do that too long, only 3 months, maybe
Yeah.
three bands at a time on each side.
Did you get much out of that, or do you not
I
even
don't,
notice the
I don't
difference?
think so. I mean, I don't know. I mean, maybe a
Yeah.
little bit, but nothing too significant that you would notice like
Yeah.
the expansion that I received. So
Yeah.
just
Nothing
wanted
like
to say
nothing
that.
like the. Yeah. Well, look, man.
Yeah.
I really, really, really appreciate you coming on and teaching other people about the struggle that you went through. I mean, I don't know how much of my channel you've seen, but that's basically what the essence of my channel is that I've been on and I've showed people, where my treatment went wrong and what I would have done differently, and I try to help people avoid the pitfalls that I went through.
Yeah.
And I feel like before you came on, you had the intention of coming on and educating people not only about the positives about your treatment, but also the negatives.
Yeah.
And, um, hundreds or perhaps thousands of people are going to see this, and your willingness to come on and be honest
Yeah.
is going to benefit a lot of human beings.
I'm excited for that. Yeah, and I mean, I've been following your channel probably since like 2020, so not the beginning, but just kind of when I got into researching jaw health and breath work and whatnot, and yeah, so I appreciate your videos a lot, so thank you for that.
Awesome, man. Awesome, man. Cool.
Yeah.
All right, man. Why don't we take it offline? I want to speak with you a little bit more.
Okay.
Um, so I'm going to end the recording and then hang on because we got to let your footage upload and then we can also talk. Okay?
Sounds good. Thanks, Ron.
All right. Thank you so much, man.
Thank you. Appreciate it.
All right. All right. You're welcome.